Hello there, fearfully and wonderfully made human. Welcome back to the Holistic Counselor Podcast, where faith, science, and whole person healing meet. I'm your host, Diana S. Rice, licensed mental health counselor and certified integrative mental health professional. This podcast exists to break stigma, bring honest and informed conversations about mental health, and remind you that you are not alone and that there is hope. Over the past few years, we've been building a bigger story, one that blends biology, psychology, and theology to explore what true healing really looks like. And if you're especially interested in the world of psychiatry, these previous episodes dive deep into that space. Episode 11, Unveiling Cultural Competence with Dr. Dorothy Chatelier Orellis. Episode 18, Radical Truths in Mental Health with Dr. Roger McFillin. Episode 20, From Pills to Purpose with Dr. Nina Joy Mina. Episode 67, Psychiatric Deprescribing and Women's Mental Health with Dr. Amy O'Donnell. If conversations like these speak to you, take a moment to rate, review, and share this podcast. It helps others find quality, stigma-free mental health content, and it lets me keep bringing you thoughtful, faith-integrated discussions. Now, speaking of thoughtful discussions, today's guest is someone I've seen at several South Florida clinical events, and I finally had a chance to connect with him. And honestly, he's a breath of fresh air. Dr. Tzvi Furer is a dual board certified child, adolescent, and adult psychiatrist and the founder of Palm Tree Psychiatry, with offices in Jupiter and Boca Raton and telehealth services across Florida, New York, and Connecticut. What stood out right away was his integrative human approach to psychiatry. He doesn't just prescribe and move on. He blends psychotherapy, medication management, lifestyle, and compassion in a way that honors the whole person. Today, we're diving into what it truly means to practice holistic psychiatry in a field that's often misunderstood. So, take a deep breath, settle in, and get ready for a conversation that may challenge what you thought you knew about psychiatry and hopefully leave you feeling informed, encouraged, and seen. Dr. Furer, thank you so much for joining me today. I'm so excited.
Oh my goodness. Thank you so much for the kind introduction. And I really love the way you sort of summed up sort of the work that I do. And honestly, it's always been a pleasure seeing you around a number of events in the South Florida area as well. And I think it's always just such a pleasure to just see all the great work that's being done in the region. And yeah, I think that sort of spreads out even further than that.
Yeah, for sure. So I want to know, I always ask my guests this question is like, how did you get to be at this point, right? I mean, you did your training at NYU Bellevue. How did
Mhm.
that shape your practice today?
I'd say quite a bit as well. So yeah, so I think, by sort of the NYU Bellevue of it all, I'm a New York transplant. I had moved over from New York a couple of years ago, settled very nice into the South Florida area, but I'm very lucky to have gotten the training that I got, first in Brooklyn, at SUNY Downstate and Kings County, Hospital Center, as well as later on at NYU and Bellevue. And honestly, it allowed me to, with both sites, really allowed me to sort of really integrate a lot of work. I'm really thankful for the training that I got in both general and child and adolescent psychiatry because it wasn't just limited to one site or one location. It allowed me to really see the work that's being done in a lot of different modalities. And in addition to also seeing just the different disciplines and different fields of psychiatry, it allowed me to gain a very fresh lens in terms of just multi-interdisciplinary work with other disciplines and working alongside with therapists, with social workers, with other individuals, with counselors, interventionists, music therapist, everything you could sort of imagine. And so it kind of really got the wheels going for it. And I knew it really allowed me very early on to kind of realize that the work that I was doing was much more than reaching for the prescription pad or reaching for a medication. It was really in figuring out kind of the needs that were there, really looking at individuals from a biopsychosocial model, which was ingrained in me from a young trainee, I was going to say, and really allowed me to sort of practice in a way that I'm finding more and more. I guess others don't practice in that way, but it just really, I'm thankful, and I hope that my patients are thankful as well for the work that I do.
Yeah. Well, how did you get into psychiatry? Because listen, when you were younger, I mean, did you know? Like, were you 12 years old and say, when I grow up, I want to be a psychiatrist? Like, what made you go into psychiatry when you could have
It,
went into so many different, our field is very vast, like you said.
Yeah. Yeah, no, absolutely. So I'm one of those folks that knew from a very young age I wanted to be a doctor. So I knew I wanted to be a doctor, just a medical doctor from a very young age, probably about 4 years of age. And I think my parents were very much like, oh, he'll grow out of it. Never did.
Right.
So I was there. Everybody knew me among my classmates in high school and so forth. It was just like, oh, Tzvi's going to be a doctor. And I always had a passion for working with children. So I actually thought that I wanted to be a pediatrician for a little while growing up. And it wasn't up until I got into upper level high school. I did like a pre-college program at Johns Hopkins one summer. I started taking some psychology classes, and I started to realize that actually my interest was really, besides working with people and besides the medical field, it was really working with sort of the way that people function, the way people think, processes, different things of that nature, just the human condition. And I really went in sort of, full hog, I'd say, in terms of college. I went to college at upstate at Binghamton University, and I wound up having my undergraduate degree in psychobiology because it wound
Oh,
up being
wow.
the degree that allowed me to take all my pre-med classes. And then at the same time, I was like, oh, I get to take philosophy. I get to take computer programming classes. I get to take other things and the psychology classes that I really longed for. And to me, it sort of clicked at that point. And so by the time I was applying to medical school, I think I was pretty well aware. I was like, hey, I want to go into psychiatry. And I'm going to be honest, I went into medical school, loved a lot of what I saw, have a lot of respect for a lot of other disciplines. But I gotta say, I felt the most happiest when I was in psychiatry on the floors, doing the work that I was doing. And the moment that I sort of hit my general psychiatry rotation and everything went well there, I actually rotated through a unit in Northern Virginia and loved it so much. Everybody there knew I wanted to go into psychiatry. I went immediately to my advisor and I loaded up every elective in psychiatry that I could think of, and child psychiatry specifically, sort of merging my interests. And so I wound up being very lucky to do a lot of electives in sort of the New York area, other places like that. And really, I think it's one of these things where sort of the passion grew from there. But I've just always been interested in sort of psychiatry and interested in sort of the field. And honestly, probably the reason you've seen me around of a lot of events is I just love being around different places where other people just feel as passionately about mental health.
Yeah. And I want to understand the cultural competency part because that's really, really
Mhm.
important. Dr. Furer, the things I saw as a clinician, right from the get-go, when I first graduated, I was in alternative schools. And and I think and I know that's a long time ago. So hopefully the training of psychiatry has opened up more, but it was very, very conventional insurance based where
Yeah.
they saw the symptom, here's the prescription, and that's all they cared about. Me being like a case manager is that's all. They
Yeah.
didn't they were forgetting the human, they were forgetting the
Yeah.
kid, I got so angry because I'm like, this person's from this culture and you're not understanding that's what they do in their culture.
Yeah.
How did you learn? Like, you serve incredibly diverse communities. I mean, New
Yeah.
York City, I know I'm from New York too, by the way, Dr.
Yeah.
Fuhrer. Yeah, and across Florida and Connecticut. So how do you make sure your care is culturally competent, whether it's understanding their faith, family systems, or cultural norms around mental health?
Yeah, it's a wonderful question, and I think it's definitely something that is I think so important and gets lost in the shuffle, and I think definitely is something that is not often sort of spoken about as the first priority, right? I'm very lucky in that when I got my training, so when I began my psychiatry training specifically at SUNY Downstate in Brooklyn. There, it was a very multicultural center, as you said, New York City being that. Later on, Bellevue was kind of the same way as well, and NYU. the training that I got really instilled in me sort of the idea of cultural competence. And so that was something I remember we actually received a couple of lectures on, and we actually were able to talk about it. And we were actually able to talk about it. I'm very thankful for my mentors and supervisors who kind of spoke to me about different conditions and would speak to me and say, look, it's really important. Talk to somebody about their background. Where do they come from? Understand about it. And we really did actually a lot of work in terms of what's I believe first popped up in like the DSM-4, later expanded in DSM-5, sort of about the culturally bound syndromes. And so knowing more about those syndromes that are specific to certain cultures, right? And so knowing about sort of what's happening, right? So it's knowing about things like the evil eye or knowing different things about ataques nervios, just knowing about sort of just different things that relate to sort of different cultures really allowed me to understand what was happening and to take a step back. And it allowed me to gain a lot of flexibility as a clinician because I feel like, unfortunately, a lot of people go through training and they go, well, here are the questions, here's the HPI, here's a review of symptoms, here's all these other things. And allowed me to actually create a really broader interview that actually is kind of like, even sort of more pleasant for me to get to know the person and what's happening there. And what I found, the more that I practiced that and more I asked about, gently trying to figure out about their culture, if their religion, if they're comfortable about it, even sort of all of those things, what I found was that people opened up and started telling me things that they wouldn't tell their other providers or they wouldn't tell their primary care folks. Sometimes I even had it where they wouldn't even tell their therapists of years. And they said, well, I never felt comfortable enough with them to talk about it. So to me, it's something where, when at my practice now at Palm Tree Psychiatry, I practice a really sort of, 360 evaluation and sort of a really comprehensive evaluation of sort of just trying to figure out what sort of makes a person tick and what's going on there. And it just, is that something that is normal to their family structure? Is it something that they even view as a problem? Because it's something where I'm not going to sort of prescribe and say, oh, well, this is a problem if they don't view that it's a problem. And I'm trying to understand it, I guess, within that lens and trying to understand that, besides even sort of culturally, just also developmentally and sort of from where they come from where people have gone that. And I'm very lucky too, sort of knowing that my family were sort of immigrants. I think knowing that and understanding sort of the culture that sort of came from, understanding the lens that allows us sort of be able to capture that somebody is coming from because maybe they're integrating into the country, maybe because they're trying to figure out what's going on, and maybe understanding if what they may not even view as a concern is putting it in a lens that allows to go, hey, life could be better. And it allows me actually from there to prescribe the correct treatment, right? You mentioned that I'm sort of more of sort of like a integrative, holistic provider. And look, I certainly prescribe medications, but it allows me to kind of meet people halfway and understand, hey, maybe you're a better candidate for therapy right now. Maybe you're a candidate for some complementary treatments. Maybe you are somebody where we've got to talk about the process. And that's why I always say that when somebody comes to me for an evaluation, they're not walking out with a prescription necessarily. They're coming out with a plan, they're coming up with the guidelines, and they're coming up with an idea of sort of just building a connection and maybe having themselves finally heard for the first time.
Wow, Dr. Furer, that's amazing. Like I love that. Okay, so let's just go through how someone comes to you, right? Because to me, I mean, I had to go to a psychiatrist a couple of times back in 2020 when a lot of stuff was happening, right? Thank
Mhm.
goodness I kind of found someone that was holistic. If I would have known you, I would have went to
Yeah.
you, but
No, thank you. No, no.
but it was like I know that those that I do work with as a therapist, and they have to have their psychiatrist because I can't do what you do, right? That I think
Right.
let's tell the audience a little because you know what? A lot of people don't really understand the difference. Like some people want to call me Dr. Rice just because, and I'm like, no, I'm not a doctor. I'm not.
No,
I have a master's
absolutely.
degree, but I want people to understand what the difference between psychiatry, psychology, and then us as therapists. Can you explain
Oh,
that a little more?
1,000%. No, very, very comfortable sort of talking about this as well. So when I describe the role of it, I think people talk about the general field of psychology psychology, psychiatry, and it blends a lot in together, right? We're talking about concepts that go all the way back, centuries, that sort of go back to, the big names in the field, Carl Jung, Sigmund Freud, folks, individuals like that. Talking nowadays, when we talk about providers, I think when most folks think of sort of therapy, the most basic sort of foundation, right, of therapy, and people sort of call it counseling as well. We're talking about having somebody, right, that's an objective third party to talk to be able to sort of talk through the aspects of your life, and to be able to sort of and be able to do that, right, in a therapeutic holding environment that allows somebody to sort of really blossom and allows to do that, right? Because this is the same reason that you can't go to a friend, a partner, a parent, a colleague, right? Because objectively speaking, everybody's going to be connected. And, I think there is that misconception, right? That I go to therapy, I'm going to get advice. And it's not always that case, right? Sometimes, but not always. As a psychiatrist, what that means for me is that a psychiatrist by the definition is somebody that is a medical provider. So they are a physician, they graduated medical school. So at the very least, right, 4 years of medical training, medical school. And then from there, they undergo what's known as sort of a residency. And a residency has sort of changed over time for psychiatry specifically, and residencies vary by medical specialty. A psychiatry residency is about 4 years in length. There's about 4 years that's there, gives a lot of time for sort of diversity and a lot of times to be able to sort of explore a lot of options. From there, I did a 2-year fellowship in there. So my residency was in general psychiatry, learned about kind of a little bit of everything. And then from there, I further specialized for 2 years, specifically within child and adolescent psychiatry. So I specifically, again, very broad, a lot of settings, inpatient, outpatient, in the field, a lot of settings like that. I am board certified, which meant that I sort of, at sort of the head of these organizations are certifying medical boards. I took the exams, I passed them, I am sort of certified. And so as a psychiatrist, that allows me the ability to do not only therapy, which I do sometimes, but also prescribe medications. And so that is something I do because of my medical training. I am very well aware and equipped. When appropriate, I'm always a fan of sort of go low, go slow, lowest effective dose possible with medications. And that could be for a variety of conditions, right? Depression, anxiety, ADHD, trauma. I could talk for hours,
Yes.
all of them, right? I know it's
Yes.
a big thing as well. But speaking, sort of broadly about it, is I know psychiatrists sometimes get a little bit sort of conflated with sort of other therapists. Again, I'm a hugely in awe of those who provide therapy as well. So like I said, I do that. So a medication management session looks different. Might be somebody that comes in for 30 minutes, 45 minutes. Hey, how's the medications going? Check in, et cetera, et cetera. A therapist is somebody that's going to sit, and typically sessions are 45 minutes, an hour, maybe longer than
Oh,
that.
wow.
An opportunity to sort of be able to sort of explore and be able to sort of try to figure out sort of those things. So there are people that sort of specifically individualize and specialize in therapy. Those that can be sort of counselors, those who could be psychologists, those are folks that get PhDs and go to graduate school. And they could be licensed social workers. So the field's broadened quite a bit. And actually, in a
Right.
lot of ways, I'm excited about that because that's allowed a lot of access, right? Because as we know, right, mental health rates of various conditions have gone up. People need help, and I'm just glad that people are getting the help that they need.
I agree. I agree. I love what you just said. Go low and go slow. I have never, ever in my 50 something years of my life have heard that come from an MD. I love that, Dr. Furer, and that's so important too because I think, I mean, I know you definitely know the book The Body Keeps the Score, right? I learned so much
Yeah,
from that book and from that psychiatrist. He's a psychiatrist, correct,
he's a
Dr.
psychiatrist. Yeah,
Salvanta? And I just realized, like, yeah, if we were able to do that, but it's like it's a hard thing because it's like taking the time to sit with a human being because they're so uniquely made, right? And so how do you now let's talk about this integrative approach because do you ask like, hey, now we need to go get your blood work done so we know because if it's a mineral deficiency or testosterone, I mean, 'cause I had a 19-year-old who was
yeah,
really super depressed and thank goodness that I pushed to go get the blood work done and
yeah,
it turned out that that's what it was. We could have put the psychiatrist could have prescribed a whole bunch of different medication and put
yeah,
them into that road. What do you say
absolutely.
about that, Dr. Fuhrer?
To me, that's something I feel like it's a story that I've heard before. It's something that I've experienced myself. And it's something where I'm very thankful also for, not only the training I got, but for the way that I practice right now is that I am a big believer in terms of a medical workup as well. So, part of the initial evaluation for my practice is going to be a discussion about medical backgrounds, medical history, allergies, sort of those sorts of conditions. And we're going to figure out, right, are there any medical conditions that could be contributing to causes or things like that? But in addition, I'm a huge believer in things like blood work and assessment and lab values and being able to assess for those things. And the truth of the matter is that I've been in that situation too, where I've had folks that have come in with profound symptoms of depression, anxiety, and I said, look, maybe we should go get something tested. I remember years ago, I was in training. I had one individual that looked like, some of the most prominent symptoms of depression I've ever seen in my life. And I said, look, you need to go for blood work ASAP. And what came back was a thyroid level that was so abnormal. I've not seen a level since as well. And look, I'm not going to sugarcoat it as well and say, oh, that's it. That solved everything. But it was a huge factor once their thyroid was under control. And we actually were able to control symptoms with a very low dose of medicine. But it's the horror story that you hear on the other side, right? Is that what if, we had gone months, maybe years trying to titrate a medication, trying to figure out, didn't get to the right dose, didn't figure out other things, and then suddenly we were in that position. So to me, I'm always thankful. I mean, I always say to patients, look, I'm not hoping for bad outcomes or anything like that, but I think that when we search for things like blood work and lab work, I think sometimes a good thing if we're able to find a medical cause and able to treat that and able to get to the bottom of it. Because to me, I feel like that is able to sort of encounter and we're able to sort of achieve it, I think. And I've seen some success and I have some people where, we find medical conditions that greatly alleviate things. One of the things I could mention, right, is like I'm a big believer in assessing for sleep, which is something people really don't talk much about. And I could probably talk for hours about that as well. And I'm always struck by a case of I was seeing maybe an 8 or 9 year old some years ago. And I remember they had very prominent symptoms of ADHD, attention deficit hyperactivity disorder of the hyperactive type. Parents were mentioning that it was very difficult to control some elements of the behavior. It was starting to interfere in school. And I began to ask about their, they started describing that not only was the child snoring, but gasping at night and having difficulties. And, just so everybody's aware, that could be a big, big sign of what we sort of known as sort of sleep apnea, specifically obstructive sleep apnea. So I told the family that it was pretty much an urgency that they had to go get a sleep evaluation, a sleep study, and go assess it. They found very prominent symptoms of it. They immediately went for a surgery. And the symptoms improved so much that he went off of the medication and he was able to sort of be completely off of it. And so it's something that is discussed in the literature. And so I think getting back to your original point, I think just the medical assessment piece is so important. So, even though sometimes patients will feel like it's a sidetrack and they want to talk about what's happening in their lives, and believe me, I'm interested, it's so, so important to get to the medical piece. And it just, to me, it's so frustrating when people go into systems, right, where, and this is part of why I set up sort of my practice as like a concierge style. It allows me to give extra time, extra flexibility, extra availability for folks as well. And I think with that allows me the opportunity to do extra assessments. And I have, a network of medical professionals, of people that I could consult with and work with. And to me, I think that means the world, right, in terms of being able to get people in right away to sort of assess sort of what's happening and often relieve symptoms in a way that, look, I'm a big believer in medications as well as therapy, but the medical piece is so, so important. And I worry it gets neglected in a 15-minute med check in some clinics or gets assessed when somebody is rushed along.
Yeah, I mean, that's what I see a lot of, or I have seen a lot of, is that symptom management instead of root cause, instead
Yeah.
of getting to the root causes of things. And this is where I want to ask is, okay, first of all, concierge care. I remember
Yeah.
watching a show and I forgot what the show was about. It was very entertaining though. I think it was on Netflix of the doctor and then I don't know, or I forgot the name of it. But anyway, I was looking, I'm like, wait, they just go from, do you travel from place to place? I mean, what do you mean by that concierge care? Like, what does that
Yeah.
really mean?
Absolutely. So concierge is, it's a concept that I think that, it doesn't mean one thing concretely, and I think different practices may have slightly different structures as well. Concierge to me means sort of a mindset and approach of being able to go up and beyond for the patients and families that I work with. So, what concierge means to me is that I'm able to sort of provide a lot more attentive services. I'm able to be there, a lot more comprehensive care. And a lot more care coordination that might be done in a clinic where somebody is being rushed along with 15-minute appointments, 30-minute appointments, seen every 3 months, those kinds of things.
Mm.
And it's one of these things where, it's a longer discussion where sometimes those are the burdens that are by insurance. Those are things that are mandated by different things. And so it's why I personally practice out of network in terms of being able to sort of provide extended level of care, being able to provide the treatment that I feel is necessary often with that, right? I worked in a hospital system before. I previously, when I was in, New York, I used to run an adolescent inpatient unit, and often sometimes we'd be limited by insurance in terms of medication treatments, in terms of hospital length of stay, in terms of ability to provide, and often have to provide discharge and aftercare in situations where we could have used more time. My practice allows me to really sit there, and I often will, sit with families for extended periods of time. They know that concierge care means that they could reach me around the clock. They could reach me after hours. I'm very available via a secure portal. I've offered late hour appointments. I've offered weekend appointments. I have done, I have offered in-home visits before. So I feel like sort of there is a sort of a level of care that I think allows me to sort of go outside the limits of sort of the current medical system, and especially with mental health, where we talk about aspects like mental health parity and different things, right? Unfortunately, insurance is not recognizing the full extent of some of those needs. My practice allows me to practice care where I feel that that is the level that people need, and it allows me to get results and allows me to sort of get that feedback from people about things, that things are working and that they are happy with the care that they've received.
Okay. And so does that mean just private pay then?
So yes, yes, I am private pay. My practice does offer super bills for reimbursement. So
Oh,
some
okay.
folks are able to get reimbursement for services, but that does mean private pay. Yes.
Okay. All right. And so I want to know now about you taught courses. You taught courses on sleep, narrative medicine, and even
Yes.
love, right? So
Yes.
why is storytelling such a powerful part of psychiatry, and how do you weave narrative into your patient care? And what does that mean?
Oh my goodness. I love this question so much. I had such a blast teaching, and I actually was just recently at a child psychiatry conference and got to connect with some old colleagues as well. And I was literally telling them, I said, maybe one of the things I missed from New York was the ability to teach as well. It was such a privilege being able to do that. So I taught several courses at New York University, undergraduate courses, and allowed me to really get in there. So I designed courses, everything from, midterms to grading myself to final exams and everything like that. And I loved all the courses that I taught. The narrative medicine one really, I'd say, really stuck out to me because it really became kind of my project, and I really crafted it from the ground up. It allowed me an opportunity to kind of really talk about the stories that are being told. And I'm a big fan of film, media, television, and allowed me to incorporate a lot of those things into class. And so I really enjoyed being able to talk about kind of the intersection of mental health and pop culture, to be honest. And it really allowed me to sort of be able to connect with what was happening. With narrative medicine, we are very lucky to be in mental health in a field where, unfortunately, right, like I think, other medical specialties, as much as I respect them, it's all about what's the blood tests, what's the exam show, what's the imaging show, and it's kind of more concrete. We're very blessed to be in one of the fields that we get to hear somebody's story. We're blessed enough to be able to hear their story, to be able to hear where they come from. And I was very inspired from when I was early on in my medical training by the books of famous neurologist Oliver Sacks. The Man Who Mistook His Wife for a Hat was still one of my favorite books I've ever read. And to me, it was a profound ability to talk about somebody's story, not just about what they were experiencing, but so vividly that you were able to see them and almost see them sort of come off the page as well. So I really do believe in mental health that it's a unfortunate thing that where can occur that somebody could have these symptoms, right? And they get labeled into a diagnosis. And one thing that I would always, I don't want to say preach, but I would always sort of talk a lot about to the annoyance of my students sometimes is that folks are not defined by their disorder. So to me, it was a big point of frustration in clinical work or otherwise, what folks would say, oh, this person's a bipolar, this person is a schizophrenic. And I would often stop them and say, no, this is an individual that is experiencing bipolar disorder. This is an individual with schizophrenia. Because unfortunately, right, sort of the system tends to boil it down a little bit too succinctly, and that's it. And unfortunately, this is what gets labeled, and somebody gets labeled by the symptoms that they're experiencing. And I think by being able to teach at such a level to undergraduates, it really allowed people to sort of bring in kind of early life understanding and be able to do that. And we would get individuals that were going into the humanities. I remember I had people that were going into filmmaking, people that were going into medicine or anything else you could really imagine. And I remember getting a lot of feedback that people were really impacted by it. And we used to kind of break it up by having pretty much a class devoted to a condition. Again, probably it's impossible to talk about everything, but it really
Right.
allowed us to kind of explore a lot of things and lenses of just what was happening around us. And I think, my hope was always that people walked away with a better understanding of mental health, of it just not being something that's a boilerplate topic or a point of frustration, is that there's a lot of conversation that's there. And I think really allowed me to, even as much as my medical training really allowed me to sort of craft my idea of like what medicine should look like and to be in a place that's very client or person centered, to be able to hear somebody's individual story and not just assume what's happening paternalistically.
Yes, I mean, because some of us we get so trained. I remember being an undergrad and the DSM is the Bible for me. They kept
Right.
saying that the DSM is the Bible, but I'm like, okay, you're giving us boundaries. I get why we have to label, but I don't understand, the nocebo effect, right?
Yes.
You get
Yes.
the label, and all of a sudden something happens inside the human, some humans, not all, because
Yeah.
I don't want to, generalize. But that's important, that narrative therapy. Why aren't you teaching that to us, Dr. Furer? You could actually create a CEU
Yeah.
for us and do this for us. I would pay money to come and learn what you just talked about.
I would love to. I think
Let's do it. All right.
you're
Well,
kind of inspiring me.
that's
Yeah.
after we record. We could create a. I'm serious because I know the FAMCA, the Federal Mental Health Council Association, is looking for people to teach. I'd rather do it live, honestly, because I'm so over, being online all the time.
Yeah.
I
Yeah.
think we had that conversation. Like that's why we love to go live to these things too. Is just
Yeah,
because
no,
we're
it's
not.
you need the break from the day, right? You need to be able to
Yeah.
go
The
see human
tele.
beings, maybe grab the occasional snack or something like that. I think
Yeah,
100%.
being a telehealth provider. Okay, so listen, I know that there's going to be listeners, especially my listeners, that are going to be like, "All right, Diana, that's great and dandy. He sounds like a great, wonderful psychiatrist, but I can't afford him. All right, I
Yeah.
can't afford him." What would you say to someone like that? Because I'm thinking of people that I personally know that are going to say that to me.
No,
And what would you, like encourage them? Because I know it's really important for them to learn to be an advocate of themselves because some of them are in community mental health. They are seeing psychiatrists. They feel like they're stuck. Like they're stuck forever taking this prescription.
right.
Like when I talk about, well, have you talked to your psychiatrist about deprescribing? That's a word that's often not used with psychiatry at all, but I do work with women that might have started at 13 years old, 14 years old on antidepressants, for example,
Yeah.
and now
Yeah.
they're 25, 26, and they want to have babies and they don't want to take those medications. So like, how do you put those safeguards into place and maybe help the person advocate for themselves? Like what do you say?
Absolutely. I think these are all wonderful points as well. And I very much understand. And I think, when I speak with people about sort of the services that I provide, I understand that sort of, unfortunately, right, that it's access wise, I understand, financial wise, and people just may not be ready for sort of that level of commitment. And I completely understand that. And I'm somebody having been trained in sort of the community health system and being able to do that. I completely get that. And what I would say is that getting any care is better than no care. And I think that unfortunately, right, unfortunately, sometimes this winds up becoming a barrier where people just go, well, I can't afford this, or I don't want to spend the time. I don't want to be able to do that. And unfortunately, what could be resolved quickly winds up taking, years, and things sort of prolong and sort of conditions sort of worsen as well. What I would sort of say as well is that, if you are in a position, right, where you're with a provider, I say one, there's always that position to sort of, change it around. I say there's always the position to sort of, ask questions about your condition. I think you're always entitled to know what you're being treated for, what you're being diagnosed with, and understand what the treatment plan is. And so even when I worked in community health clinics, very much the practice was every 3 months, we're going to do what's formally known as a treatment plan. So we're going to come up with goals and be able to do that. If you are in a place that's not discussing your overall treatment, and I always sort of joke and say, they're not trying to get you out the door, they're not trying to get you better, it's worth asking those questions. Say, hey, what's there? And, to your point about deprescribing, whenever I prescribe an antidepressant, part of my conversation is always, look, this is not a lifelong medication. And we talk about the sort of the sort of off ramps of like, hey, we're going to take this. And I typically say 6 months to a year, then we may reevaluate. And I have taken people on lower medication doses. I've taken people off of medications directly. And I'm also not going to sugarcoat it as well. Some people do tremendously well, and sometimes I never hear from them again. All the best. Sometimes people come back and say, hey, my symptoms got worse, or hey, this has started coming back. And so we have the conversation about it instead of as well. I'm always interested in, I understand that, my practice is private pay. I understand it's a concierge style. I understand that that format may not be sort of the best and the most appropriate for everybody. But what I do say is that I always want to work with folks that want to make the commitment, with folks that sort of want to get better. And I want to have folks that 100% are ready to sort of get better. And so I think so too. And if I were to do an evaluation with somebody where it was found to be that they were like, well, I'm not sure if I want to do that, I'll give them resources. And even within, our South Florida community, I know individuals that take insurance. I know folks that are more accessible. I know folks that, charge more than I do. It's a wide range of it, and it sort of depends on sort of what people are looking for. And so I'm always about the best fit. So I'll say this about me. It's like, hey, I may not be the best fit. That's great. Like, I think I want to get you there. And I know for a fact that the literature shows that the best progress is going to be by folks that feel connected with their therapist, their psychiatrist, their any treatment provider, and be able to do that. So that to me is sort of the way for access. But, if I were to give sort of any advice to sort of the listeners, it's that your treatment is very much your ability. You should never feel in the dark about what's happening. To me, the scariest thing is when somebody gets put on multiple medications, doesn't understand what they're taking, it doesn't understand what the plan is. So I think it's worth questions. And, and I hate to put it out there, as much as there are wonderful providers out there, if you're ever questioning it, sometimes I do even second opinion evaluations. It's one-time evaluations just to say, hey, I'm looking at this. I'll provide you a letter. I'll say this is going well, this is not. I think those are, those are very opportune, and I think those are very appropriate sometimes as well. And just to understand what's happening. One more point, as I sort of think of it, is just please, allow the opportunity for open communication. I think the best treatment results will happen when, if you're seeing a psychiatrist or you're seeing a therapist, allow them to talk to each other, allow them to communicate. And I often find the best results are going to be where that's happening. And
Mhm.
I've often, in cases where part of my practice, right, is I'm super collaborative. I talk with therapists all the time, probably to the point of annoying them. I would say that really I have found things out about medication treatments, about things that I didn't come from the patients directly because of hesitation or because of maybe being scared. And we're able to have much more open conversations and people get better. And I'd rather find out sooner than later that something's going wrong.
Yeah, yeah. I mean, we're in the helping field and we want to help the person to become productive citizens of our village, our society, right? And that's so important. So, as we wind down, Dr. Fuhrer, is there any like books or resources or anything that you can leave the listeners with that maybe just help them to, if they're like struggling right now with anxiety or depression or ADHD or ADHD, like any kind of practical tools that you can share with us that you know of?
Yeah, I mean, I think it's a great question. I'm a big fan of sort of some self-help books and some things like that. I think a lot of stuff that came, for example, like I'm just a big believer in cognitive behavioral therapy. So a lot of stuff that comes from like Aaron and Judith Beck, I just happen to sort of side with as well. I think there's a lot of like pop culture things that have sort of popped up. I've been prone to reading a Mel Robbins book or two, and I feel like those are really solid as well, and a lot of good advice there. Yeah, I mean, it's gonna, I would say it really varies by the condition, but I think, trying to really be open-minded and not everything has to be kind of a cut and dry medical textbook kind of thing. I think there are some
Right.
great narratives about people's individual stories. And I know this from when I taught my narrative medicine class, is that if I go back to the syllabus of that class, a lot of it was actually not medically based books. So a lot of it was like just talking about conditions. Like when we were talking about bipolar disorder and borderline personality disorder, we would talk about this book. When we would talk about, major depressive disorder, we would talk about, another book. So there would be a lot of different conditions and a lot of things to talk about, elements that are out there. And I think there are a lot of great voices out there. One of the things that I'm just most thankful for is that mental health is getting more and more into the conversation. I'm sure you can attest to this. And so more people feel open about it. And I love the creativity that's out there. And it doesn't even have to be, this medical novel anymore. It could be a graphic novel. It could be a podcast. It could be sort of lots of things to that extent. And whatever way is getting there, I think that, for better or for worse, there's more conversations happening on social media, places like TikTok and Instagram. And there's a lot of information to wade through. And I think a lot of it
Yes.
is correct. And again, we could probably talk for another hour about all of that. But truly, the conversation is out there. And so I think it's worth vetting sources and figuring that out. But I'm more than happy to always send to you if you would like specific resources, if you want to, put it in the show notes or something like that. I could find a couple things for you.
Yeah, whatever. I mean, that's what I usually do. This is why I did create this podcast, Dr. Pure, because you know what? You're one person, I'm one person. We could see maybe, I know my bandwidth, I cannot see more than a certain amount of humans in the week. And, this is why I love this format and that understand. And I love like for you to teach. I mean, you're hitting more than one person at a time. You're hitting a group of human
Yeah.
beings to give them knowledge and wisdom and encouragement on how to become healthier holistically. And that's why, to me, these conversations are super, super important. So, where can someone find you if they want
Yeah.
to work with you?
Absolutely. So I am on the World Wide Web. You can find my practice at www.palm, P-A-L-M, tree, T-R-E-E, psychiatry, psychiatry.com. For fun, I also bought the domain palmtreepsych.com. So in case you want to just to take off a couple of letters as well. I am becoming increasingly more active on places like Facebook, Instagram. Haven't quite made the TikTok journey yet, but maybe one
I
day.
won't touch TikTok. I saw what it did with, I worked at alternative high schools for most of my career, Dr. Furer, and I saw what was happening. And I'm just like, oh, this is why there's such an influx of anxiety and depression, right? The symptoms, and we're trying to get them better. But I'm teaching people to curate now because
Yeah,
there's no
I
way
think
we're going to get it,
100%. I think
right?
curating is such an important thing because there are important conversations that are happening.
Yes, I
Again, I will come
agree.
across something that's like, oh, that's great. It allows me to, I'll integrate it and bring it into therapy, and it allows me to
Yeah.
feel like things are fresh. You know what I mean, as well.
Yeah.
I've been trying to, I also sort of write the occasional blog or two on my own website, on places
Okay.
like LinkedIn. So again, trying to get my voice more out there. Maybe teaching some courses in the future, but we'll see about
I
that.
want that narrative
Yes.
therapy. That to me, because I'm very into the creative sphere of things. Do you work? What's the youngest you work with and the oldest you work with?
Absolutely. So I currently say the youngest I work with is about 3 years of age. So again, doesn't pop up that often, but I'll work with the little ones. And I work all the way up to, I say, somewhere between 60 to 65. I mean, I do work with older individuals. I just always give the caveat that I just don't have that certification for older individuals. And so I do have some real trusted colleagues that if they happen to be, more comfortable with that or sort of want to work with that. But I'd say firmly within the age range of kind of 3 to 60-ish is sort of definitely sort of in my wheelhouse, and happy to help out and work, well with individuals, with families, and sort of just the structure as well.
Oh, all right. Wonderful. Is there anything you'd like to say to the audience before we say goodbye?
I would like to say that I really appreciate the opportunity. First and foremost, I really had a wonderful time talking with you. And I think just to the audience, I would say, take your mental health seriously. Take it as seriously as your physical health, and don't put things off. I think those things you'd be surprised how quickly things snowball. I think we found this out during the pandemic, right? How quickly these sort of things snowball. So don't hesitate to sort of reach out to get help. And it's a real sign of strength, I would say, sort of, if anything. And I could only say positive things about those who sort of, be able to do that. But, wish the listeners the best. And honestly, thank you so much for the opportunity to speak today.
Yes, Dr. Furer. And listener, thank you if you've made it through the end of this episode with us. And remember to please always trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.